Hey, everybody. Welcome back to another episode of Confessions of a Male Gynecologist. I am your host, Dr. Shawn Tassone, and I wanted to kind of bring things into um, perspective here. I'm going to take a little bit more of a somber tone, but wanted to, first of all, tell you about a couple of things that I have that might help you as a listener, might help you as a woman struggling with hormonal issues. If you're being gaslighted by the medical community, there's some resources I have for you that might help you kind of stop struggling and get what you need. The first step would be the book, The Hormone Balance Bible. What I did in that book is I took the last 40,000 patient encounters that I had and started hearing some similar stories. So I grouped those all together into the 12 most common hormone imbalances, put them into the language of archetypes with a 6-step process on how to fix these hormonal issues using spiritual practices, hormonal modulation, energetic aspects of medicine, nutrition, exercise, and supplementation. The second option for those of you that want to dive deeper and go farther would be to look at my website, thehormoneproject.com. The Hormone Project is my attempt to get to the women out there that want to learn more. They want to go deeper. They want to find more information. It's a monthly membership site where you're going to get a monthly meeting with me. As a matter of fact, we just did it 2 days ago, and I spoke in depth about supplements. I taught my top 5 supplements for women's health. I went into more depth on the labels, how to read labels, how to know predatory marketing when you hear it. Just more information. The last month I talked about thyroid. Every month is a different theme. We're going to go deeper. Also, you'll get a 20% discount off of all your supplements through Full Scripts, which in and of itself, depending on how many supplements you order, you might actually pay for the membership right there. You'll also get a discount on your new patient appointment if you're not already a patient. I'm also going to be bringing in authors. They're going to be giving us freebies. I'm going to be bringing in big friends, and they'll be giving us freebies. So I think it pays for itself. I think for those of you that want to invest, $1.10 a day for the membership, I think it would be well worth your time and your effort. I also, if you follow me on Instagram at Shawn Tassone MD, I talk a lot about my weight loss programs. I had a woman on my Instagram page yesterday, Julie, who lost 40 pounds with me. Basically, it includes my weight loss program includes all the visits with me, 3 months of medications, hormone balancing, all the supplements you're going to need. And it's at one price. And currently, there's a discount of $200 on that program. Also, if you want to call the office for an appointment, you can give us a call at 512-956-0296. I am currently licensed in 40 states in this country. I'm trying to get all 50, but it takes a while and it takes money. So I'm more than happy to see you if I'm licensed in one of your states. What I want to talk about today that is a little bit more serious is what's been going on in the media. And I really wanted to talk about the murder of UnitedHealthcare CEO Brian Thompson. And the reason why I want to do this is there's a lot of providers out there that are really using this to grow their platforms. And they're talking about the disgust that there is in the healthcare system and the disgust, especially with the insurance companies. And what I want to do is I want to break this down into kind of just a reframe of everything as it's kind of unfolded. And I want people to then have the ability to hear about the frustrations on the physician side. I'm also a patient. I'm 57. I have my own insurance. I actually use Blue Cross Blue Shield. I pay them an ungodly amount of money every month just for my own insurance. I think it's around $650 a month, and I don't really use it. And then when I try to, like for my cataract surgery that's upcoming, they don't want to pay for it. So I get it. And the surgery is like $8,000. So it's a mess. It's the system is a mess. But what I wanted to point out is the way the system works and what happened to this guy, this gentleman, Brian Thompson, who has 2 young boys that are in their teens, and how it's just not his fault. I mean, the companies are these massive megaliths that screw everybody. But anyways, I'm I am an expert and I'm a doctor, and I have used insurance for out of the 25 years of my career. Let's see, I graduated residency in 98, and then I went into the military. So we didn't take insurance, obviously. It's a socialistic medical system, and it works okay, but there's also downsides to that. And you can talk to anybody that lives in one of those countries that has a socialized medicine. You could diagnose yourself with a lump, and it can take 6 months to get a mammogram. So there's good and bad everywhere. But I was in the military until 2002, so I've been practicing now for 22 years. A year and a half of those were cash based. So I took insurance for 20 years. I took Medicaid, I took Medicare, I took all of the plans. I've applied to all of the plans. I've tried to renegotiate my rates with all the plans. I've seen the reimbursements go down over the years, which made physicians then have to go to a more volume-based product, which sucks for everybody because I can tell you when I was an OB, right now I only do gynecology. When I was in obstetrics, you would see 40 to 50 patients a day. And as a male OBGYN, I didn't do a ton of deliveries because women prefer seeing women, which is understandable. But you have to then even churn out more volume to get where you want to be. So it's a horrible system. I remember when I was a kid, it was fee for service. You would go in, you'd pay your insurance, or you'd pay your bill. And it worked. I mean, I totally remember it worked. You could pick your doctor. Prices were reasonable. And then insurance came in probably 45 years ago and really messed things up. But suffice it to say, it's not any one person's fault. So let's rehash what happened. The shooting of UnitedHealthcare CEO Brian Thompson happened early in the morning in New York City. He was fatally shot outside the Hilton Hotel in Midtown Manhattan, December 4th. And he was heading to his annual investor day at the company's United Health Group annual meeting. And he was shot in the back, which is in its face horrible on so many levels. I mean, the fact that he was murdered in cold blood, obviously cold, calculated murder, and was done in a way that he didn't even see it coming. I mean, maybe there's a benefit to that the poor guy didn't know what was happening, but he was shot in the back. Afterwards, you've seen the fallout, a flood of social media posts voicing negative experiences with insurers. And I just heard a poll this morning, actually, on my way to work, that in certain demographics, especially in younger people, probably under the age of 30, there's about a 40% approval rating for the murder of the CEO, which is astounding to me that anybody in this country would condone murder out of anger, out of spite, out of jealousy, out of rage, out of not getting what you wanted or feeling gaslighted. I mean, whatever the reason is, I just find it hard to believe that they would justify murder. Like, and if you want to turn that around and say, well, what if your parent was a healthcare provider, insurer, or something along those lines? And then where does this stop? Do you then attack your doctor? Do you attack your nursing staff? Do you attack hospital staff? I mean, where does this slippery slope end? And I think we have to just say, no, this is not acceptable under any circumstances. But the reactions are crazy. I mean, there's people on both sides, but it just seems to be that the media is focusing more on how the killer looks. He's got the washboard abs and he's a young guy and he's attractive, and they're all talking about how they would want to date him. And I just find it appalling. Well, U.S. patients here in the United States spend way more on healthcare than anywhere else in the world. We know this. And yet we have one of the lower life expectancies among large wealthy countries. And this is found through the Commonwealth Fund, which is an independent research group. over the past 5 years, the United States spending on insurance premiums, out-of-pocket copayments, pharmaceuticals has also increased, and we're paying more for everything, not just healthcare, but everything. And I have my opinion that it is because of the insurance companies. What happens is the insurance companies are indeed concerned about their profit margins. I mean, this is no surprise. They have to pay their investors. And what happens is they will decrease. They have to get the money from somewhere. So where do you think they get it? They increase the premiums, which goes to you, and then they decrease payments to hospitals and doctors. That's how they make money. And it's interesting because everybody gets screwed, but the insurance company. I think the anger with the CEOs is that they make these mega $1 million things where they're making $50 to $200 million a year, and they have stocks, and people look at that as a huge dichotomy. And I will tell you, the only people making huge amounts of money in the medical industry are the insurance companies. This is not a surprise. There's a lot of advocacy groups and experts that say the industry and U.S. healthcare system is obviously flawed and broken. The American public is having to carry that burden, and American healthcare is a complicated and horribly entrenched system that costs the nation about $4 trillion a year. So it's a massive, massive industry. And as I said, my opinion is that the insurers play a big role, and the costs and the pressures and the feelings and the other issues. And UnitedHealthcare in particular, I will tell you from my own experiences, were the worst. And this is not just coming from me. I hear other doctors talk about it all the time, even hospitals. As a matter of fact, the biggest radiology group here in Austin, Austin Radiological Association, they have probably 15, 20 locations in town. They're huge, humongous. They canceled their contract with United because United wouldn't negotiate with them and wanted to decrease their rates. If anything, we should be getting an increase in rates. If you think about inflation, they should be increasing their rates. And instead, what they do is they go down on the doctors. So United Healthcare was canceled, meaning everybody in Austin that would send patients to ARA, which was a huge number, had to stop sending to them because this is what they do. They're a gorilla. So they're going to throw their weight around. ARA tried to negotiate with them. And you can imagine if a company with 100 physicians tries to negotiate what I would get as one doctor. They're not even going to talk to me. But anyways, they wouldn't negotiate. And they said, this is what they do. They'll say, fine, if you don't want to take our rates, you won't get any of our patients. So we'll send them all somewhere else. So then you've got these other mom and pop places that are smaller that will want the contracts because of the volume. And so they'll take a lower rate. So the doctors groups undermine each other on the back end to try and get the patients. And so they'll take an even lower rate than what ARA was going to take so that they can get the patients. And then ARA gets undermined in their negotiation because the doctors won't stick together because it's a dog-eat-dog world out there. So they pit us against each other. And I will tell you, UnitedHealthcare, without a doubt, in my opinion, is the ultimate worst insurance out there. They were the first insurance that I dropped. They deny things constantly. I had one case where they actually gave me an authorization to do a hysterectomy. I did the case as they said I could, no problems. Billed it out, sent it in to them, and they denied it. And I said, wait a minute, you gave me an authorization. The lady came back and she said, authorization doesn't necessarily mean you're going to get reimbursed. It doesn't guarantee reimbursement. Sorry, I was struggling for the word there. Doesn't guarantee reimbursement. And I said, then why the hell did I have to get the authorization? Because then you wouldn't get paid. Well, I'm not getting paid. Yes, but if you hadn't got the authorization, you wouldn't be. So they waited for me to do the surgery. Now, I've already taken this woman's uterus out. I can't put it back in, right? So I have to then turn around and bill the patient because I didn't get paid. Neither did the hospital. So now this woman who had done everything right, she went through the process. We called the insurance. We gave them the diagnosis codes. We gave them the procedure code. We told them where we're going to go. We're going to go to the hospital. We gave them the hospital. Everything got an authorization number. Patient did everything right. I did everything right. Hospital did everything right. They still turned around and denied it after they said it was okay. That's a bait and switch. That is unethical, and that is insurance malpractice, in my opinion. So I can see where there's anger. I understand that. As a matter of fact, on that case, I ate the surgery because I didn't want to turn around and bill the patient. So the system is broken. The pressures are huge on everybody, and the patients are highly frustrated in the flawed system that we have. The unfortunate thing is the U.S. healthcare industry is dominated by private sector companies like UnitedHealth, CVS, Cigna, Aetna, Anthem, and Blue Cross Blue Shield, and they operate these companies largely for profit. Now, I'm not opposed to profits. It's not my problem. I don't think that it's difficult in medicine because it is a for-profit industry. And you compare it to industries where they have socialized medicine, which I don't believe works very well either. You get stuff for free, but you have higher taxes and you don't necessarily get the care you want or the things you want. So it's a healthcare industry based on rich people because only the rich people can go get the care that they want. Now, that being said, maybe we'd be better off if we did a two-tiered system where you have healthcare for all, but you also have a private sector for people that want to pay more, and you can have doctors opt in. I think that we should do something along those lines where we have a system by where everybody has healthcare. Doctors coming out of residency have to donate 4 years of their time to working in that healthcare system, and then they can choose to stay or they can go outside the system and do private health insurance, which would also be offered. The problem then is that poor doctors coming out of medical school that have $300,000 in debt couldn't go into a healthcare system that was based on socialized medicine because they wouldn't get paid very much. That's part of the system. And they wouldn't be able to pay their loans back. So then you'd have to go back even farther and maybe make healthcare subsidized by the US government, which I don't see a problem with personally. So what happens is the healthcare industry's primary goal is to generate profits by charging premiums. I just mentioned that. That's what they do. They charge me $650 a month. And if I don't use it, that's sheer profit. Sounds like a scam. Like, where else in your life would you give somebody $650 that they're never going to use? Then what happens is the primary goal to generate profits to customers and then manage the claims to minimize the payouts. I've had friends that worked in the health insurance industry. They basically took on a medical advisory position where they get paid to review claims, and they will tell you flat out they got paid to denied claims. They would bonus on how much money they could save the company. And here's the thing. Let's take a different case where I put in the paperwork, say to United, for the patient. She needs a hysterectomy. They deny it. So this time they don't give me the authorization. Let's say they flat out deny it. We have to go through the process of appealing it. They deny it again. I have to get on the call with the medical advisor, another physician. And this physician isn't a gynecologist. Say it's a pediatrician who took the job. She denies it because she's checking boxes, or he. They deny it again. So now I have to request to talk to an actual OBGYN, which is going to take about 30 to 60 days. I finally get on with the OBGYN and they go, sure, yeah, I can totally understand. Yeah, we'll go ahead. What the company is hoping for is that by exhausting you, because if I had to do that 5 to 10 times a week, I'd go out of business. It takes an hour to do that. I mean, I would literally go out of business. So I can't do that. And they know that. So they do it so that you have to jump through all these hoops. And then they can say they actually approved it and they didn't deny it. What they're hoping on is that you'll give up. You will give up. The other thing that they do on the back end is woman comes in for a visit. I'll bill a code 99214, which is going to probably get me $80. I send it in through my electronic record system. They'll kick it back saying it's missing something. We'll send it back. They'll kick it back again. They'll keep kicking it back, and then they'll deny it for some reason, but I can appeal it. So again, I have to appeal it. Do I want to go through the process to get the $80 or do I want to give up? When I was in a bigger practice that had 12 doctors, they had probably 10 people doing billing. So they have to pay 10 people to bill to follow up on all these crappy claims. So anyways, the tactics of delaying or denying valid claims is rampant. They basically just increase their profit margins by doing this, and it's unethical, in my opinion, highly unethical. But that doesn't mean necessarily that this CEO Brian Thompson, I think the assumption is that he knows that that's happening and he condoned it. We don't know that. It's probably part of the culture, yeah. But did he come up with the culture? No. Was it part of his diabolical plan to hurt people? I don't think so. I just think it's capitalism. The problem though is roughly half of insured people worry about affording their monthly healthcare premiums, and they basically added that a large share of adults with employee-sponsored plans and government coverage rates them as fair to poor. So people that are on, they get excited because they're getting employee insurance. They don't like it because it's not very good. So it'd be interesting. It'd be easy to fix if we knew why they denied claims or how often they denied claims, but they're not required to disclose that data, which is another problem. They want doctors to be transparent. They want hospitals to be transparent. We have to post prices. We have to do all this stuff, which is fine. But the insurance companies don't. They don't have to give you numbers. Like if we knew that 5 of the big healthcare insurers denied 17% of their claims and United denied 54%, well, that should be investigated by the insurance, oversight committees. But they don't make them do that, which is wrong. UnitedHealthcare, which is the largest private health insurer in the United States, posted a $281 billion revenue last year. Not million, billion. $2,810 million. That's an unfathomable. That's probably a bigger revenue margin than most states. Last year, for example, United settled a case brought by a severely ill student at Penn State University. The claim was that the company denied coverage for drugs that the doctors determined were medically necessary. Sounds familiar? Leaving this young person with a bill of $800,000. A company called ProPublica, which I sort of like and despise at the same time, outlined that the lengths that UnitedHealthcare went to reject these claims included burying medical reports. And United settled the case with an undisclosed amount, of course. There are people that you hear about in the news who sued UnitedHealthcare for allegedly saying the company knowingly used a faulty algorithm to deny elderly patients coverage for extended care that was again deemed necessary by doctors. And in the court filings, United Group said that that they wanted it dismissed from the lawsuit because the patients and their families didn't finish the appeals process. So the patients were wrong for not appealing. Again, taking the time to do something that should be covered anyways. And I don't think this is unique to healthcare. I mean, I've often said to my kids, insurance is great until you need to use it. And the same thing goes with auto insurance, life insurance, whatever it is. When my stepfather died, he had money with TD Ameritrade, and their computers were down. I'm not kidding you. I called them because they wouldn't answer me when we were trying to get his death benefit. Their computers were down for probably 12 weeks. I'm not kidding you. I'm not exaggerating that. It might have even been more. I don't know how that company ran without a computer system for 12 weeks or if they were just flat out lying to me. I had to submit paperwork 3 or 4 times, and it wasn't like it was a lot of money. But you pay your insurance all this money over your lifetime, and then they don't pay out, and you're gone, so you can't argue with them. The same thing with auto insurance. I was in a car accident, and somebody sideswiped me on the interstate. They hit me. I got their license plate. They stopped, thankfully. And I was just driving in my lane, and they came over like they were changing, and I honked, but they didn't have time to back up, and so they dinged my door. And so it goes to the insurance adjuster, and after like a month, the other company, which I think was Geico, came back and said that I was at fault, so they weren't going to pay the claim on behalf of their driver. Now, the damage was on the side of my door, so obviously I couldn't hit somebody with the side of my car. I got hit, but they were just flat out denying the claim. So then what I had to do was I had to say to USAA, who has my insurance, that I needed to fix my car. So they paid for it, and then they raised my rates. So someone ran into me. I got my rates raised. I don't understand that. But I'm not going to go murder somebody because of this. I'm just going to be frustrated as hell, and maybe I'll change a different company. So what is the root cause of all this? What the heck is going on in our country? The industry experts in this area argue that it's necessary for insurers to control costs. Insurers are mostly paid by employees and government agencies, which then set out the rules. If insurance companies paid out every claim they received, premiums would skyrocket, according to Evan Saltzman, who's a professor in risk management, insurance, and real estate at Florida State. If you want to keep premiums reasonable, you don't need to insure everybody. The thing is the way that they make money is they insure healthy people. Healthy people pay for the sick people. That's how insurance works. They get a bunch of premiums from people in their younger ages, 20s, 30s, 40s, 50s, and they're hoping that you don't use the insurance because they know that the sicker people are going to need the insurance. And so it's a gamble. It's a gamble that they make enough money. Obviously, they made $280 billion, so they're doing all right. That's just one company. They also agree that there are bad actors in the healthcare system, but they say it's doctors. They say that there's doctors out there that are lying to the system, which they are, and they get caught all the time for doing Medicare fraud or billing for patients that don't exist and the like. But nobody ever investigates the insurance companies for denying the claims. So the United Health Group, not the CEO of UnitedHealthcare, but the UnitedHealthcare Group, which is their funding agency, basically blamed a lack of transparency in the insurance industry in a New York Times opinion piece. He said insurers, together with employers, governments, and other payers, need to be better explaining what is covered and how those decisions are made. So what they are basically saying is people don't understand their insurance policy. And I would totally agree with that. People don't. They think that they have insurance, stuff's going to get covered. Most of us anymore have a huge deductible, meaning everything you do up to like $3,000 or $5,000, you have to pay for. So it's really just catastrophic coverage, and people erroneously think that they're covered, but they're covered for major catastrophe, not for the day-to-day stuff. there's another problem in the industry is that there's limited competition. There's like 4 to 5 bigs, and they dominate each other, and they keep buying each other, and the government keeps letting this happen. And as they consolidate and expand, they become bigger and bigger, and they have more influence. So, how can healthcare be reformed? I don't know. There's smarter people than me that are dealing with this. The point being is that we have a broken system. I wanted to come on and talk about it because it really aggravates the hell out of me that there's physicians out there using their platforms to grow, and they're basically using gross analogies to not condone the murder, but to just bag on the insurance companies. And there's no need to bag on them. Everybody hates them. It doesn't invite murder. There was a physician out here in Austin, a pediatrician, a wonderful woman, who I think it was maybe 3 or 4 years ago, had another pediatrician come in, and he wanted a job. And they interviewed him, I believe, but they didn't hire him. He came back. I have a friend who was one of the other pediatricians, and she was out in the parking lot doing COVID testing because it was during COVID, the peak of COVID. So she was standing outside doing COVID testing, and she saw the guy drive up and walk into the office. And he pulled out a gun and he shot this pediatrician and killed her, point blank, killed her. Turns out he had terminal cancer, so he was dying anyways. But he killed this person for not giving him a job. This is part of the problem. We have the decency in this country is disappearing. The anger is rising. People continue to be angry, and eventually what's going to happen is what we see happened here in New York. Obviously, the healthcare system needs a major overhaul. I hope that this tragedy can turn somewhat into a positive by maybe bringing this to light, but I don't condone the way that it was done. So just a little primer on the healthcare industry. Sorry to get too serious there, but I just felt like I needed to talk about it a little bit, just to, even for myself, to just reason through it. Remember, the Hormone Balance Bible is on Amazon. You can go to thehormoneproject.com if you want to get more information and learn more. And I'm always here at Instagram. I talk daily. You can give me a shout out at shawntassone.com. Hope y'all have a great day.